All right, well, good morning. It is July 6th, Monday, 9:02 a.m., and I hope everyone had a wonderful and safe, happy 4th of July. I know Ed, who's on the call, our special guest, he had an interesting weekend, so I'll let him tell you all about that. But either way, here we go. So good morning, everyone. We have a lot going on this week. So as you know, we have trainings that are rolling out from all the carriers. But before I do that, I want to recognize our top producer for the month of June. And that honor goes to Mr. Jeff George. Congratulations on your excellent work. You did 25 Medicare Advantage enrollments. So Jeff, congratulations and great job. I know you and your team are really knocking it out of the park. So I really do appreciate that and the hard work that you do out there. So congratulations to you, sir. I hope you do it again. I know you'll do it again. And 25 is preliminary. He might have a few that he forgot about, that he forgot to report, but knowing him, I know he did an excellent job. So great job, Jeff, to you and your team. Excellent work. So trainings for this week, it's a little light on the trainings, and the reason why is we've got AHIP that's rolled out. We have the certifications that are rolling out for all the different carriers this week and this month. So they're kind of spacing out these training sessions because you need to put on your calendar, hey, I got to get my AHIP done. I've got to get my Humana training, my WellCare training, my Freedom training. You got to get those things done because they're rolling out right now. So the only trainings that I have on the calendar, Tuesday, tomorrow at 10 a.m., which is July 7th, Humana is doing their WebEx on the Enrollment Hub and what you need to know. And again, guys, all these enrollment hubs, you should be learning right now. You do not want to be learning these things in the middle of open enrollment when you're trying to do actual applications. You want to learn these tools and these resources and softwares now, okay? The other one is also tomorrow, July 7th at 11 a.m. Humana is teaching you on how to do a successful virtual meeting. I've been getting questions on, what platform should I be using to do my meetings on? I'm not really sure on how to do this compliantly. Well, Humana is going to teach you how to do that. And remember, all these Humana trainings kind of coalesced with Care Plus. So those of you that are selling Care Plus, it all works together, guys. All the softwares and all the tools and trainings are virtually the same. So that's at 11 o'clock. Also on Tuesday the 7th at 2 p.m. tomorrow, there is a telephonic enrollment training, again by Humana, and they're going to teach you on how you can do your scope of appointments and your electronic signatures by telephone, and that is tomorrow at 2 o'clock. The only other training is a big one, but this is on Wednesday, July 8th, and this is at 10 a.m. Humana is doing their Facebook marketing training again, and this was asked again to be hosted, and it received some great feedback. So they're going to continue to teach you how to do marketing on Facebook. So if you haven't checked that out, that is on Wednesday, July 8th at 10 a.m. And what's really cool about their system is they have templates of Facebook ads and things you can use on Facebook ready to go. So all you have to do is plug in your information, your picture, your cell phone number, your email address, and it's pre-approved and ready to launch. So there's a few compliance things that you need to know before you're able to access those templates. So please make sure you go to that training so you can learn on how you can do some marketing on Facebook. So those are the trainings for this week. Outside of that, guys, the deal is get your AHIP done, get your trainings done early. I can tell you that AHIP was just as tough as it was last year, maybe even a little tougher than it was last year. So you're going to have to spend 2-3 hours really sitting there. And remember, guys, this test isn't to trip you up or to help you lose your license or anything like that. This test is to educate you so you can educate your clients and your prospects. Okay, it's not here to trick you. It's to ensure that you understand the materials, and it ensures that you know what you're talking about, because you're going to go out there, and if you don't know that material, When somebody asks you a question about Part A, Part B, Part C, Part D, or even Part E, which is on the test, you need to know what those are, okay? And if you don't know, make sure you study that AHIP test, okay? So certifications are out. Bright Health just came out last week. WellCare's training is going to come out tomorrow on July 7th. And that one is going to be a combined certification with all of the Centene products. Okay, so now one certification and you'll be able to do WellCare, All Well, Ascension Complete, those of you in California, HealthNet, and then in New York, Fidelis Care. So all of those plans are now under one roof, one certification called the ACT, which they actually borrowed from WellCare. So that certification comes out tomorrow, and the good news is you do that one training and you get all those products, including the WellCare Part D programs, in case you're just doing Part Ds as well. So that way you don't have to bounce around. So one less training for you to do this year. Thank goodness, right? So one thing good came out of that. Speaking of WellCare, because of their merger with Centene, they have designed a new legal contract for all agents, and it is mandatory that you complete this new contract from WellCare. So Jessica will be reaching out to you from our contracting department to remind you. She's going to give you a call, a text message, a flare gun, an email, a messenger pigeoner, whatever it takes to get you that message to say, look, you've got to get your WellCare contract done. If you have business with WellCare and you fail to do your contract by September 30th, you will be suspended. And I hope that doesn't happen to anybody. And then if you don't get it done by, I believe it's December 1st, you're actually terminated. And you will lose all of your commissions, all of your residuals if you're suspended. And then obviously once you're terminated, you'll lose everything for good. So don't let that happen. Please make sure you go out and get your new contract done. You have all been sent the email directly from WellCare. So you just click that DocuSign. It literally takes 3 minutes to read the document, go through it, and sign it. It doesn't take long. But please make sure you get that done. I don't want to see anyone lose their commissions because they just simply didn't open their email address. All right. News with Humana, and this also goes for Care Plus. Many of you are out there helping those folks with D-SNPs. So if you have Medicaid or you feel that one of your clients has Medicaid and you want to check to see what level they have, before you had to call the company. Now on Humana's Vantage portal, you can actually log in and check Medicaid from your phone, your iPad, and your laptop without calling anyone. So all you have to do is log into your Vantage portal, and there's a new link on how you can actually check Medicaid right from your portal system. So I thought that was super, super helpful because I hated having to be on the phone and waiting for somebody to check Medicaid status when I was sitting there across the table from Mrs. Jones and she's, you know, twiddling her thumbs waiting for me. So you can jump on your Vantage portal, you can plug in their information. I know that if you have a 10-digit Medicaid number, that helps. If you've got a card control number, that helps. But the old social and date of birth will help as well. So as long as you have that information, you should be able to get in there and check Medicaid status on the Vantage portal. Some news from Ascend. Ascend is the enrollment platform that now is being used by Aetna, Allwell, and WellCare. So all of those products, you can now use the Ascend eApp platform. Again, we have Connecture, and Connecture you can use for United and Aetna at this moment, and then in New Jersey you can use it for Amerigroup and Clover as well once Clover is loaded up. So what we're trying to do is help you combine some of these eApp enrollment tools so you don't have to learn every single company. You can learn just one or two of these things and it should cover most of the companies. But their PURL system, under the Ascend, you have a PURL. Right now it's disabled because they are getting ready to launch a new updated one. And this is a unique personal URL, a personal website that you can send out to your prospective clients, and they can click a button and they can enroll themselves and you get full credit for. So this is a really, really cool feature, especially right now with how awkward everything is. If folks don't want to meet with you, that's fine, but you could jump into your Ascend and email them out. I believe you can actually start text messaging out these links as well, so people can click on it and get the information they need and do the enrollment. But right now it's disabled. They will be launching a brand new one on the Ascend platform. And again, that's your personal website that people can grab the information and then, go in there and do the enrollment remotely without, ever having to meet with you if that's their preference. Regarding marketing, United Healthcare has some brand new veteran marketing materials available on the toolkit. So just log into your Jarvis and then go to the toolkit there. United is the forefront on all those marketing materials that are available. So they have flyers and pull-up banners and all sorts of great tools that you can download specifically to the veteran market. So if you're working with vets or if you're going out to the VA and talking to those folks or whatever the case might be, if you need specific veteran materials, those are available on the UHC Toolkit as we talk right now. So you can go out there and get that. There is a contest for Aetna Supplements. So Aetna Supplements, their eApp, if you write the Aetna Supplement eApp, you get a $75 bonus if it is underwritten. If the person's in their open enrollment, their guaranteed issue, you get a $25 bonus. And that's just for using their eApp. So it looks like most of these companies are starting to move in that direction, giving you a little bonus for using their eApps. That's from Aetna. Last thing on my list before I bring in our very special guest, we have, as you may have read on the AHIP, we have now the ability to market to seniors by email. So you can do that. There's a couple of stipulations there. Number one, you have to have an opt-out option available on your email address. So you have to give the senior or the Medicare eligible the ability to opt out from email. So there's different email services out there that you can check out, such as MailChimp, or they have Constant Contact. So you can actually purchase an email list and create an email campaign and send it out to seniors, and this is completely compliant. However, before you send out an email, please run it by one of us or run it by a health plan, because the message is still under compliance and we want to make sure that that is being sent compliantly. But the deal of the week is, if you would like to work on your emails and have an email list, just send me an email by 11 o'clock today, and I will work on getting you a list of emails that is available for those that are on Medicare. So that's the deal of the week. Just shoot me an email by 11 today, and we'll send up a request for getting you an email list of seniors in your area. So with that, I'd like to introduce a very special guest that's on the call. Mr. Ed is on the call from Dedicated. Dedicated Health is a brand new provider group that's moving into the Orlando market. However, they have offices all over the state. So I am going to bring him on. And Ed, can you hear me?
Yes, I can.
Perfect,
Good.
Perfect.
Well, good morning, everyone, and I'm happy to share a little bit about our organization here in Orlando as we get started. We are new to Orlando, but as Justin indicated, we have actually been in this market, in the Florida marketplace, since 1985. We were started by a gentleman by the name of Dr. James Chen, and he has an honorary emeritus role right now, but his sons run the organization. We are now in several different markets in different states. We market under 3 different names, just so that you know. In South Florida, if you were in the Fort Lauderdale or Miami-Dade area, we go under Chen, C-H-E-N Med, which is Dr. Chen's name. In other parts of the state of Florida and in other parts of the country, we're known as Dedicated Senior Medical Center. And just so that you get an idea, right now, Dedicated is in Bradenton, Florida, in Cincinnati, Ohio, Cleveland, Ohio, Columbus, Jacksonville, Lakeland, Florida. We're starting here in Orlando, Memphis, Tennessee, Palm Beach, Philly, St. Louis, and we've got a very large operation in Tampa. More are coming soon. And by the way, in Atlanta, Chicago, Louisville, New Orleans, Richmond, and Tidewater, Virginia, we're known as GenCare. And GenCare is actually partially owned by Humana. So that's our joint venture. GenCare is our joint venture in some states where we're actually partnered with Humana. So we have Humana's backing. We are very happy that we're finally breaking ground and coming to Orlando. Right now, we have 2 locations that are under construction. One is in East Orlando on South Goldenrod Road, and the other location is in Pine Hills, Hiawassee Road. We are also starting our 3rd location in Orlando, which is going to be on OBT. Now, just so that you understand, we work in the Florida market in Orlando. We work with Care Plus, Humana, Simply, and Optum, Freedom Optum. We're in contract with a 5th, but I'm not able to indicate. But it's all well, if you know what I mean.
Very good.
Okay, so a couple of things that we want to make sure that you understand. We have lots of competitors out there. We have a lot of clinics, but we truly are looking for those that are underserved in the community, those that have chronic conditions. Our motto is we have a 3-step process for compassionate cares. Our physicians in our centers have a maximum of 450 patients on their panels, as opposed to many physicians, other locations where they may have up to 2,000 patients. In the new market, so in Orlando, we will only have 300 patients per physician. The reason there is that we can give more hands-on, more dedicated time. Our first visit to our docs is about 40 minutes. All of the patients have their PCP's cell phone number. We encourage people to come in once a month. In fact, it's part of our process of our managed care philosophy is PCP care driven, where our doctors see our patients once a month. Our facilities offer everything from Mary's Cafe, which is Dr. Chen, your founder's wife's name, and we offer all kinds of food there for patients that are diabetic or folks that come in and maybe they're in for some lab work and they get a little hungry. They can do that. Our maximum wait time in the lobbies are about 15 minutes, no more than. The doctors spend time. It's a process. We have our doctors that sit with our patients. We have a team of different specialists. As the doctors see the patients, we have our own dispensary with about 250 medications, so that as the doctor is writing any new scripts, changing everything, it gets sent over to the dispensary. The idea is that by the time the doctor's finished with the patient, the medications have been dropped off by an employee of the dispensary right there in the office. We will also have lab, X-ray, ultrasound. We will add on a specialist as the panel grows. Our first is usually a cardiologist. So in some of our larger centers we're established, we have cardiologists, endocrinologists, neurology, and we also have at all of our centers acupuncture. And that comes from our background in Eastern medicine and Dr. Chen. We offer at no cost acupuncture to our members for pain, anxiety, anything that is prescribed for. There are also labs, X-ray, ultrasounds, and in the larger locations, we will also have CAT scan available. So we're going to be offering Tai Chi classes and other methods of relaxation. So it's really a all-inclusive type situation. And to distinguish ourselves from our competitors, I know that a lot of the competitors have their big buses, and they bus seniors to the center and back. We've been doing that, but we have been running some surveys, and we have been doing some studies and brought in some consultants. And while a lot of our seniors use the transportation and they need it, especially Orlando and the underserved, what we found was that many of them didn't like the fact that, you know, they get picked up on a bus. They get picked up at 7 o'clock. Then there's 10 more stops to pick up 10 more seniors. So they're wasting time there. And then when they got finished, they had to wait for a bus, and then again the same thing. And sometimes the first one to get picked up in the morning is the last one to get dropped off in the afternoon. So we partnered with Uber Health. It's a new division of Uber. It's Uber Health. And all this side does is medical transportation, non-emergent medical transportation. And we have, we started in certain areas. The last area to change over was Miami-Dade, which changed at the end of June. So in Orlando, we'll be offering Uber Health, and we'll coordinate. Our staff coordinates everything. The staff at Chen Med will contact the patient the day before his or her appointment, let them know. Your Uber Health driver will be there at whatever time to pick you up, name, blah, blah, blah. And then that they don't have to wait because they pick them up and drive them directly to the center. And when they're finished having their care, we have their Uber Health driver to take them back. No waiting for a bus, no multiple stops. You get picked up at home, brought to the center, and from the center, you go back home. So we see that as a tremendous, tremendous advantage. The doctors we will have MGCs as well, and I'm the market sales manager, so my role will be to lead the acquisition of members to our panels. We will work with you. We are going to be working with the carriers, but the best thing for you is that we can help you to get folks enrolled. And remember, if you are writing someone up for Humana, who is my old alma mater, or Care Plus, we can assist you in enrolling them into. So we're not changing insurance. So if you're writing them and they're going, you can talk to them about, especially the most important people here are those that really get left behind, the ones that perhaps have more than one medical condition. They could have, maybe they're diabetic, maybe they have metabolic syndrome, maybe they have CHF, things like that, where there's several different conditions. We're trying to keep them out of the hospital. We're giving them the care. We're providing them transportation, just so that you can get an idea. Our satisfaction rate with our members is 95%. Wow. And based on studies that were done last year, our members average about 25% less hospitalizations than other members and with other PCP panels, because we see them so often. We also, if they are hospitalized, their hospital stays are normally 38% shorter. So we're providing personalized care. I don't think you'll find anyone who has their PCP cell phone number available. So it's available all the time. We will help you. We will work with you. We will set up as soon as the conditions get better here. We are going to have some lunch and learns at our training at our new sales facility downtown, right next to City Hall. But we will also be doing virtual trainings if you'd like, just so that you know more about Chen Med, how we work with Humana, how we work with CarePlus. As I indicated, Humana has actually invested money in us because they believe in our model. We are a risk model, and Humana sees the favorable results that we're having. And I think what it helps you is really to retain your clients, because if you write them and you put them into CarePlus or Humana or whatever, and they have great medical care, you're gonna keep them. They're gonna be taken care of. So that's what we're here to do. We're not here. We work with you. We're not here to take business away from you. We're not here to take business away from any of the carriers we work with, because we are not an insurance company. We are a primary care provider. And I could go on for hours, but I think that's where we are. Our first office will probably be the Goldenrod office, 690 Goldenrod, and that'll be a fully comprehensive center. The second one will be Pine Hills. The third will be in OBT, but that looks like later on in the year. But at this point, we look like we will be available for enrollment for AEP in both Goldenrod and Pine Hills. I also have a staff of what we call MGCs, which are like sales reps. We'll pair them up with all of you. So the idea is that each one of you can have an MGC assigned to you, so that MGC will help you, will go with you to a meeting, will help discuss if you have some kind of event, discuss what Dedicated does. So that'll help you not have to be bogged down so much, and you can go on to the next sale. So we're here to support you in the sales, and we're here to take care of your members. We want to establish long-term relationships with your organization, with our members. That's how we all win. And that's Chen Med's philosophy, a win-win situation for everyone. So that's it, Justin. I don't have much more to say right now.
Ed, that is incredible. I mean, the couple things that I would say that are really going to keep you apart from the competition, that cell phone to the primary care doctor. I don't know any organization that's allowing that to happen. So that's unbelievable. Yes. The private Uber drives, you're first of that kind. I mean, that's incredible. And then wait times under 15 minutes. I mean, what more can you ask for when you're looking for a doctor, you know? Yeah. And then on top of that, marketing, you know, we're all marketers here. You need help with your marketing. You need a partner. You need somebody that's going to go out there and help you look for events and look for leads and send people your way, because I know Ed's team, they don't do the enrollments. They're not licensed. They need an insurance agent to actually do the enrollment. So they'll set them up so you can knock them down. I think that's incredible. And then before we open it up for questions, Ed, is there a website that these guys can learn more at?
Absolutely. Actually, Justin, if you don't mind, I'm going to send you a couple of links after our meeting. And one is actually, which I truly recommend, our centers our medical centers are kind of, based in a certain way. There's a way, some are larger than others, but I have an actual virtual tour of one of our centers. So I will send all those things out so that you can share them with all of your team. And I think that will really show them a little more about the Chen Med difference. And remember, Chen Med is the corporate company, but in Central Florida, we're Dedicated. But if you have some folks that are in other parts of the country, we may be under, as well as I said, Gen Med, which is where we're half owners with Humana.
Outstanding. And a question just came in on the chat.
Yes.
Ed had already mentioned it. It said, when and where is the first clinic opening? And I can answer that because I was listening. Goldenrod's going to be number one. But do you have a date in mind, Ed?
Well, we were hoping to be open by the end of July, but with COVID and everything.
Yeah.
So we're looking now at the end of August.
End of August, okay, and that'll be Goldenrod, and then
Goldenrod and soon Pine Hills to follow right after that, and
Excellent.
then the OBT location will be opening towards the end of the year, and these are just the first 3 facilities. We're looking at this whole area, so Seminole County, Lake, Osceola will definitely, and we're thinking of going all the way up to Volusia as well. We're already in Jacksonville, so remember, if you happen to, anyone has someone in the Jacksonville and Lakeland or Tampa area, we're there, and of course, Broward, Miami-Dade, and Palm Beach.
Excellent. And we have folks there. So if you're interested in working with Dedicated or Chen Medical, wherever you are in the world, please send me an email and I'll connect you with Ed or one of his team members so they can connect you and you guys can start working together. And I'll tell you, I came from the physician background myself. I used to work with a similar company here in Orlando, and it's always been in your best interest as an agent to work with a physician and a marketing rep because they really can help you generate leads. They really can help you generate activity, and that leads to sales, guys. Another question on the chat is, do you have a senior center that we can look forward to possibly using or participating in the future?
Oh, absolutely. You'll be able to participate at any of the centers and come in. So we have a lot of plans, a lot of things to help. I wanted to have some sessions, live sessions at our sales office we're in the CNL 1 tower down by downtown Orlando by City Hall. We're planning probably to coordinate maybe some kind of training sessions because we were going to have some in person, but I don't think that's happening anytime soon. But yes, we will work with you. I'm going to send out this information to you once everyone has a chance to take a look at it. What I really would like to do is then have some kind of a joint staff meeting, my sales staff with your folks, and then we can start kind of pairing up people so that they know, I'm looking at names here. Ken can, let's say I put him with Chris Cook. So Kent's going to call Chris Cook whenever he has any events or anything like that, and vice versa. If Chris comes along someone, he's going to call Kent. So that's what we want to do. That's the type of relationship we want to see. So we both take care of each other.
Yeah, and that's what we look for as agents. So I mean, and this is an awesome opportunity because remember, guys, Dedicated's coming in for the first time in our market, and eventually, your competition is going to learn about what they're doing here. So this is like a first endeavor. You're first in the door, and we're really excited to be a part of that. So with that, Ed, I am going to open it up for questions. So bear with me here. I'm going to unmute everyone. So remember, guys, you may have muted yourself, so just double check that. So do you have any questions for myself? Go ahead, Mark.
Ed, my name is Mark Oster. It was a very nice presentation, so I have a couple of brief questions. Number one, your first office on South Goldenrod, how many doctors are you going to have in that office? And I assume they're all primary care doctors.
Well, we plan to have, we've already have 2 doctors assigned to that, and we will have our own chief medical officer who will actually be a doctor that will see patients. She is headed up in the next 2 weeks. She is with us in Miami, but she's taken on the role of Chief Medical Officer, overseeing all the clinics in Central Florida. She is of Haitian descent, and we are already, because as you know, and that's one of the key things.
Monday through Friday, 9 a.m. to 6 p.m. Our experienced team has the knowledge and resources to provide you with the right health plan solution to meet your needs.
There you go. Go ahead.
All right. So we will have MGCs that are Creole speaking, so they can help you in that aspect. We'll have multiple Spanish speaking represented. I myself speak French and Spanish fluently, and I can hold my own in Portuguese. So we're trying to be extremely diverse to really assist you. So yes, our center in Goldenrod will initially have at least 2 doctors. What we're hoping to do is to have at least 300 patients enrolled in our center when we go live. So that's the key. So that's why we're going to work with you. We also have 2 medical practices, large, well-known medical practices in Orlando that we're absorbing into our organization. Yes, Mark.
And so here's my follow-up question. What about specialists? Because the key to this business, I've been doing this for a number of years,
absolutely,
is your network. And you're brand new. You're right out of the starting gates here in this area. So what about specialists? I've had people, they've got lots of doctors they've been seeing. They'll probably have to drop many of their doctors to so that's an issue.
Well,
that's a question. That's my question.
But remember, we are not a carrier. So let's say you wrote a person with Care Plus. We are a participating provider in the Care Plus network. So the only thing you would be doing is recommending or getting them to enroll as you choose dedicated as the PCP. Then they'll be able to use any of the specialists. However, as I mentioned, as we expand, as we have in all other locations, we will start bringing in our own specialists that will be in the clinic that the person can either go to or go to his or her own specialist. But the network doesn't change.
And Uber Health, is that private cars or company vans?
No, those are private cars. That we are the first organization I know of in Florida that we've been working with Uber for quite some time. We will be putting out more information about that. These will be cars that specialize in picking up patients.
Thank you.
All right. Hey, Ed. Hi, my name is Kelly.
Hey, Kelly.
A couple quick questions. Are you going to have a printed provider directories for each one of the Central Florida locations and the doctors?
We will have directories of our PCP, but it's just going to be PCPs, and as we get specialists, we will. But of course, we will defer to the specialist network of whatever carrier you are enrolling your member in, whether it's Care Plus, Humana, or Freedom Optum, whichever.
Yeah, that's usually what we're familiar with is they'll have underneath each office or each doctor the different providers. The different carriers that you accept.
Yeah, well, we will accept 4.
Point of sale.
Yeah,
when you're at the point of sale and they're not sure if they want to keep their PCP or don't have one, then we can simply recommend and suggest, well, here's a location that's pretty close, and they can send Uber to pick you up, and et cetera. The other question is, are you going to have a meet and